Have you ever wondered if the medical tests you've been doing for years are still the ones your body actually needs now? Or if some of them might be unnecessary, or even missing the real issues that come with life after 70? I'm asking because many people come to me holding the same annual checklist they've followed since their 50s, thinking it's still enough, but your body changes with time. Your risks shift, your priorities evolve, and the tests that protected you before may not be the ones that protect you now. If you're over 70 or caring for someone who is, you deserve clarity, not guesswork. You deserve to know which tests truly matter for your heart, your memory, your bones, your mobility, and your long-term independence. And you deserve to understand which tests might need to be repeated less often or replaced completely. So today, I want to guide you through this gently and clearly. No fear, no pressure. Just practical doctor-backed advice that helps you stay confident about your health decisions. Because your 70s are not a time to pull back. They're a time to protect your energy, your independence, and the moments you want to enjoy with the people you love. In the next few minutes, I'll show you 5 key medical tests you should reevaluate at this stage of life, what to keep, what to adjust, and what to discuss more deeply with your doctor. As we move into our 70s, something subtle happens that many people don't talk about. Your body starts sending signals that feel a little different. Fatigue lingers longer than it used to. A small ache in the knee becomes a regular reminder. Your balance shifts. Your sleep changes. Even your appetite may feel unfamiliar. None of this means something is wrong. It simply means your body is aging, quietly, naturally, and constantly adapting. But the challenge is this. The medical tests you relied on in your 40s, 50s, and 60s don't always adapt with you. And if your testing routine stays the same while your needs change, you might miss important early clues your body is trying to share. Think of it this way. Would you use the same map for a new city just because it worked in an old one? Probably not. Your health deserves that same kind of updated guidance. Many patients tell me, but I've been doing these tests for years. Isn't that enough? And my honest answer is sometimes yes, but often not. Some tests become less necessary with age, others become more important, and a few need to be spaced out differently depending on your medical history and current risks. That's why reevaluating your tests after 70 matters, not to overwhelm you, not to add more appointments, but to avoid blind spots that can quietly affect your heart, your memory, your bones, or your mobility, areas that keep you independent and confident. So ask yourself, when was the last time you and your doctor actually reviewed your testing schedule, not just repeated it? And are you sure the tests you're doing right now match the health you want to preserve in the years ahead? This isn't about doing more. It's about doing what makes sense for you, your body, your lifestyle, and your goals. You deserve clarity, and you deserve a plan that supports the life you want to keep living. Now let's walk through the tests that matter most and how to approach them with calm, confidence, and science-backed reassurance. As we step into the main teaching, I want you to remember something important. Reevaluating your medical tests isn't about creating fear. It's about creating focus. At this age, the goal is to prioritize the tests that protect your heart, your independence, and your quality of life. So let's walk through each one clearly and calmly, and I'll explain exactly why these tests matter and how to discuss them with your doctor. 1. First, heart and vascular screening. Your heart becomes more sensitive to small changes over time. Blood pressure, cholesterol, and your heart rhythm may shift more quickly than they did in your younger decades. This is why cardiovascular screening deserves a fresh look after 70. Most people continue the same basic panel they've had for years, but the discussion behind the results becomes more important now. For example, your blood pressure target might be different from the standard numbers you've heard for decades. Your doctor may adjust your goals depending on your frailty level, your fall risk, or the medications you're already taking. You may also want to revisit tests like an ECG or an echocardiogram if you've noticed shortness of breath, ankle swelling, dizziness, or a new sense of fatigue. These symptoms are subtle but meaningful clues. Don't ignore them. This is your heart's way of asking for a second look. And if you've ever wondered whether you still need a stress test or coronary calcium score, this is the stage of life where your doctor can help decide based on your overall goals. For some, it's still helpful. For others, it may not change management. The key is individualized care. 2. Bone density and fracture risk testing. Once you reach your 70s, your bone health becomes a major predictor of your independence. A single fracture, especially in the hip, can lead to long recovery periods, limited mobility, and even long-term disability. A DXA scan is usually the standard test for bone density, but it's not just the number that matters. It's how quickly those numbers are changing. If your last scan was years ago, this may be the moment to reevaluate. Your fracture risk isn't only about bone density, it's also about balance, muscle strength, eyesight, medications, and even the layout of your home. So when you talk to your doctor, ask about your overall fracture risk, not just the test result. And if you've been on medications for bone health, such as bisphosphonates, this is an important time to revisit whether you still need them or whether it's time for a drug holiday. These are the kinds of individualized decisions that make your 70s safer and more stable. Third, memory and cognitive screening. This topic can be uncomfortable for many people, but I want to approach it with compassion. Your brain deserves the same attention as your heart or your bones. Changes in memory after 70 are common, and most of them are not signs of dementia. But early cognitive screening can help identify patterns that may benefit from lifestyle changes, medication adjustments, or simple support tools. You might not need a formal neuropsychological test. Even a short cognitive assessment during your annual visit can provide valuable insight. And if you or someone close to you has noticed forgetfulness, word-finding pauses, or changes in mood, this becomes even more important. Think of this as another vital sign, just one more way to understand your overall health. And remember, early detection doesn't label you, it empowers you. Fourth, cancer screening adjustments. This is where many people get stuck, because cancer screening guidelines change significantly after 70. You may no longer need certain screenings you've done for years, such as repeat colonoscopies or routine imaging, especially if previous tests were clear. On the other hand, some screenings still matter deeply, depending on your history and your family risks. For example, mammograms may still be recommended into your early 70s, but the decision to continue should depend on your overall health and life expectancy. Cervical cancer screening is often stopped by this age if past tests were normal. Prostate screening becomes more personalized. This is a perfect area to have an honest, thoughtful conversation with your doctor. Ask, is this test still beneficial for me, or is it time to adjust my screening schedule? There's no one-size-fits-all answer, and that's exactly why revisiting your plan matters. Finally, vision, hearing, and fall risk assessment. We don't talk about this enough, but small sensory changes can have a huge impact on your independence. Vision can shift from cataracts, macular degeneration, or simple refractive changes. Hearing may decline slowly, and many people don't realize how much it affects balance, confidence, and social connection. A fall risk assessment, something as simple as evaluating your gait, your muscle strength, and your home environment, can prevent injuries before they happen. These tests are not about aging poorly. They're about staying safe, engaged, connected, and mobile. And mobility is one of the strongest predictors of long-term quality of life after 70. So don't minimize these evaluations. They're some of the most impactful tools you have. Each of these 5 areas tells a different story about your health. Together, they create the bigger picture, one that helps you stay confident, steady, and fully present in the life you love. Reevaluating doesn't mean worrying. It means staying informed. It means honoring what your body needs now, and it means aging with intention, not fear. As we bring everything together, I want to make this as simple and reassuring as possible. You've just learned the 5 medical areas that deserve a fresh look after 70, not to overwhelm you, but to help you focus your energy where it matters most. Let's recap them in a clear, gentle way. First, your heart and vascular health. This is the engine behind everything you do, your walks, your conversations, your connections, your joy. Reevaluating your heart tests isn't about chasing numbers. It's about making sure your goals match the stage of life you're in now. Small adjustments can give you a safer, more confident path forward. Second, your bone density and fracture risk. Healthy bones help you stay independent. A single fall can change your life more than most medical conditions, and that's why this test deserves attention. Your bones, your balance, and your home environment all work together to protect your mobility. Third, memory and cognitive screening. This isn't about labeling yourself or expecting the worst. It's simply about understanding how your brain is aging, what's normal, what's reversible, and what might need support. Your memories, your clarity, and your ability to stay connected all deserve care. Fourth, cancer screening adjustments. This is where personalization really matters. Some tests become less useful. Others remain important depending on your history and overall health. You don't need blanket rules. You need a thoughtful conversation based on your body and your future plans. And finally, vision, hearing, and fall risk evaluation. These may sound simple, but they have a profound effect on your safety, your social life, and your confidence. Seeing clearly, hearing fully, and moving securely are some of the strongest predictors of long-term independence. So here's the big takeaway. You don't need more tests. You need the right tests. Tests that protect your energy, your mobility, your memory, and the moments you want to enjoy with the people you love. Always listen to your body, understand your risks, and remember that your needs at 70 are not the same as your needs at 50, and that's perfectly normal. You're simply entering a stage of life where clarity and intention matter more than routine, and you deserve care that adapts to you. If today's conversation helped you understand your health with more clarity and confidence, I'm glad. That's always my goal, to guide you with calm, practical, doctor-backed advice that supports the life you want to keep living. As you think about the tests we discussed, remember this: you don't need to make every decision today. Just start with one conversation. Choose one area you want to revisit and talk it through with your doctor. Small steps create real protection. And if you'd like more videos that help you understand your body, your risks, and your options in a simple, reassuring way, I invite you to subscribe to this channel. It's the best way to stay connected to clear, evidence-based health guidance made specifically for you or someone you love. Your health journey doesn't end at 70. In many ways, it becomes more intentional, more personal, and more meaningful. And you deserve support every step of the way. Thank you for spending this time with me. Take care of your body, stay curious about your health, and I'll see you in the next video. Take care of your health. See you next time.